No, we're not. We're not filming.
Practice. Go. Okay. Hi, I'm Michaela.
I'm Janine.
I'm Sarah.
And I'm Alex.
And our project is polymer coating for a vascular valve stent. Heart valve disease is diagnosed in more than 5 million Americans every single year. There are 3 different types of heart valve disease. Regurgitation, which is when the leaflets allow backflow. Stenosis, which is the thickening of the cusps or fusion of the cusps, which restricts the valve from completely opening. And atresia, which is the narrowing or lack of a heart valve, which restricts the blood flow. There are a number of different symptoms that heart valve disease can lead to, such as heart failure, blood clots, stroke, or even death due to sudden cardiac arrest. Lifestyle changes and medications can slow down the progression of these symptoms, but ultimately the only permanent solution is a heart valve replacement. Due to the diagnoses in the past few years, there have been a pattern showing that by 2050, the number of patients in need of a heart valve replacement will triple. So there are 2 different types of heart valve replacements, tissue and mechanical. Tissue replacements include xenogenic and allogenic valves that are chemocompatible yet suffer in degeneration. Limitations and complications due to these valves include fibrosis, degeneration, calcification, and immunogenic responses. Mechanical valves are durable, yet they do constrain geometries that do lead to shear stress. Limitations and complications of mechanical valves, other than the fact that the implantation is a fairly invasive procedure, is that they do cause hemorrhaging and thromboembolism.
Because of this, there's a need for a heart valve stent that promotes better tissue integration and additionally limits the current complications of both tissue and mechanical valves. Our approach to solve this is to use an existing cobalt chrome cage stent, as shown above, but with using a bicuspid flat design system that is made of a durable plastic. The major improvement with our design is that we will include a dual layer polymer. The innermost layer will be a PLA cage coating that will be sprayed on and degrade in about 5 years. This will prevent particles that are potentially cytotoxic to the surrounding tissue being released from the cobalt chrome cage. The outermost layer is a flow coating of polyanhydride that would degrade more quickly in about 3 to 4 weeks and would be there would be growth factors loaded on the surface, such as VEGF or IGF-1 that could promote better tissue integration through angiogenesis.
There are several benefits to a heart valve cage stent with a polymer coating. In terms of biocompatibility, the stent will have minimal wear resistance, which means that it will minimize the debris which may cause inflammation or pain to the patient. In terms of biofunctionality, the stent will promote tissue integration, which makes the stent less vulnerable to bacterial infection. The stent will also have a degradation rate which will match the regeneration rate of the heart valve. This means that the polymer coating will not degrade until the tissue has been fully integrated. The polymer coating may be more expensive, but it may be cheaper than using a stent with donor tissue included. In terms of biomechanical benefits, the heart valve, the stent will be flexible, expandable, and have a low modulus, which is desirable for a heart valve. Using a stent greatly reduces the risk because it does not need, for implementation, it does not require open heart surgery. Rather, it can be implemented through the rib cage using a catheter.
These are 2 examples of existing heart valves on the market. One is the transcatheter heart valve from Edwards, and the other is a Medtronic aortic valve. They both have a metal frame, one being cobalt chrome and the other is nitinol. And they have an inner donor tissue. These both are tricuspid systems, and ours is different because it will be bicuspid and will not have the inner donor tissue. And in addition, the one from Edwards has an outer polymer skirt, and ours will be different because the polymer coating will be on the entire middle frame in order to promote better integration of the tissue.
Thanks.
Thank you for watching.
Sorry.
Oh, that was good. That was only 4:50.